We will now review the second video of submodule 2. We will be discussing safeguards to limit risk associated with supplement use, including use of third-party testing or organizations that do random evaluation of dietary supplements, such as Consumer Lab. Also, we'll look at companies that evaluate dietary supplements and provide a certification mark or seal on supplement products. These organizations would be the National Sanitation Foundation, Informed Choice, or U.S. Pharmacopeia. Dietitians and other health professionals and consumers can also evaluate evidence-based websites, publications, and texts, and also health professionals, with the dietitians being the nutrition expert. So the first organization that we'll discuss is Consumer Lab. It is an organization that was developed in 1999. It is a provider of independent third-party testing of dietary supplement products. They do random evaluation and chemical analysis of dietary supplements of various supplement categories, and then develop a comprehensive report. Members can join the organization for an annual fee and access their reports. You see here the Consumer Lab website. You can see links to various articles. So here we see links and descriptions of many other articles or reports, for example, addressing fish oil or magnesium, various B vitamins, probiotics, protein powders, green tea, vitamin C, or calcium. This article references the Consumer Lab tests, showing that in this article, the turmeric or curcumin products with 31% failing their test. So the next slide discusses the components of the Consumer Lab tests and what they evaluate for in their chemical analysis. When Consumer Lab does the third-party testing, they evaluate supplement products for identity, they look for strength, purity, and they also look for disintegration. You can see here with a link to the Consumer Lab website and more information. We have two slides with examples of a portion of the Consumer Lab report. So this is an example of a report as it relates to the energy drinks and energy shots that were evaluated. This shows the results for the 5-Hour Energy berry flavored product, and there are various columns and categories of evaluation, and then there's a final area with an overall result if the product was approved or not approved. For this product in particular, it was not approved. It did not pass the Consumer Lab test. The items in red document reasons why it may not have been approved. For strength, that did not meet the standards, as only 86.4 of the folic acid listed on the label actually was found in the product. Also, we see that the product contained more caffeine than expected. It ranged from about 100 to up to 400 milligrams of caffeine per bottle, and you can see here that the bottles were about 2 fluid ounces. Here's a portion of a report for nutrition powders and drinks. And again, you see the names of the products here, and then the final column that indicates if the supplement product was approved or not approved. So 2 of the 3 of the products evaluated here were not approved. So one of the products, it was found that there was 4 extra grams of sugar and carbohydrates per serving, which contributed to an extra 26 calories. This product also was not approved. It was actually found to have an elevated level of a contaminant, so it was found 6 to 18 micrograms of lead per daily serving. If you're interested in more information on these reports provided for Consumer Lab, you can check out their website. There is an annual fee of anywhere between $30 to $50 to join the organization and get full access to all the Consumer Lab reports. Other organizations that do testing would be US Pharmacopoeia or USP. They provide supplement verification. For USP and these other organizations that I'll discuss, the manufacturers will submit their supplement to this organization for testing. So testing that was initiated by the manufacturer to evaluate the supplement, and if it passed the supplement evaluation, they get a certification seal. So the USP supplement verification evaluates supplement products for quality, purity, potency of the ingredients. The participation is voluntary and available to manufacturers worldwide, and you can look for this USP verification seal to ensure or to optimize quality and safety of a supplement product. So the next two organizations that we'll discuss are specific to athletes. So the first organization is the National Sanitation Foundation, or NSF. They have their NSF Certified for Sport list. So this is a public health and safety organization, and they aim to minimize the risk of exposure for athletes to a banned substance. They have this certification mark that when the product is evaluated and passes their evaluation can have their NSF certification mark. Supplements that will have the NSF certified for sport mark will indicate that these products do not contain a number of substances banned by major athletic organizations, that the supplement ingredients match the label on the supplement product, that there are no unsafe levels of contaminants, and that the product is manufactured in a GMP registered facility, which is audited twice per year to ensure quality and safety by NSF International. And you can click on this link for further information as it relates to the NSF Certified for Sport mark that is provided on supplement products. The next organization is called Informed Choice. So the Informed Choice uses this LGC Doping Control and Research Laboratory to do chemical analysis of dietary supplement products. They have also a certification program that was established in 2007, which evaluates specifically for banned substances and manufacturing practices. Companies can voluntarily register products with Informed Choice to carry the Informed Choice mark. The evaluation involves a manufacturing quality system audit, pre-registration and product testing, as well as post-certification monthly blind sample testing. For both NSF and Informed Choice, it will be very important to be aware of what's called logo misuse. And so the supplement products need to be registered or tested on an annual basis. And a product may contain a mark or a seal by NSF or Informed Choice, even if it hasn't been evaluated for that given year. So on the websites, they have the most up-to-date list of products that are currently certified. So it's important to check the websites for current products versus just relying on the supplement product bottle. We see here the website for Informed Choice, so you can visit their website and also learn more information about their organization and supplement products that have their certification. There are additional safeguards that athletes can use. So there is a website that is sponsored by the U.S. Anti-Doping Agency called Supplement 411. So those are a number of actually videos and resources that can be used to learn about dietary supplements and reduce risks. But they do have a list for identifying red flags or warning signs for products that you would want to avoid. So here's some tips. So a red flag would be those supplement products claiming to promote muscle building, weight loss, sexual enhancement, or energy. ingredients for supplements that end in OL, diol, or steen. They may be precursors to steroids. Products containing proprietary blends, because these blends do not always disclose all of the ingredients. Those products claiming to act as a treatment for a disease or an alternative to a prescription medication. Products that claim to be safe because they have been used for thousands of years or are natural or traditional. Just because something is natural does not mean that it is necessarily safe. And products containing herbal ingredients. We saw on the 30 dozen list that a number of those products were herbal ingredients. Other supplement information or resources you can find from the Office of Dietary Supplements. This is sponsored by the National Institute of Health. They have a number of information resources, including supplement fact sheets. There is also a tab for general health information for the public. There are dietary supplement videos, dietary supplement terms, a label database, as well as nutrient recommendations. There's also an area for researchers. Dietitians can also access the Evidence Analysis Library. This resource provides information primarily about health conditions. So we see the projects and the topics covered by the Evidence Analysis Library, and I chose one. Here is dietary factors as it relates to breast milk and infant outcomes. One of the questions here in the evidence summary: what are the effects of maternal diet or dietary supplements of omega-3 fatty acids on the breast milk composition and infant health outcomes? So this would provide evidence-based information on the potential benefit or efficacy of omega-3 fatty acid supplements in a woman who is breastfeeding. There's a resource found in the British Journal of Sports Medicine. It is a 34-part series of review articles that discusses dietary supplements, sports nutrition foods, and ergogenic aids for health and performance. It provides evidence-based information on the safety and efficacy of a number of dietary supplements used in sport. So it is alphabetical, goes from parts 1 to 34, and there's a link here to the introduction, and part 1 provides up-to-date information as it relates to the safety and efficacy of a number of supplement products. It indicates if a supplement product may be useful or if it may be not useful given the current evidence. Lastly, we have professional resources that may benefit the general population. So registered dietitians have extensive formal training as it relates to nutrient recommendations, metabolism assessments, and the regulation of dietary supplements. The Academy of Nutrition and Dietetics provides professional guidelines and a position paper that also addresses ethical considerations for dietitians that recommend dietary supplements. Physicians also serve as a resource and provide a key role in the monitoring of an individual's health for those who are taking dietary supplements.